We identified signs and symptoms of cystitis and pyelonephritis. Now the next learning objective is distinguish between bacteriuria, sterile pyuria, and sterile urine using the results of a urinalysis or a UA.
Now here's some definitions of different types of collection techniques for the urine specimen, and this is just for this slide is just for your information. So voided urine or random specimen. This is basically the most commonly used method by most labs. So this is basically where a cup is given to the patient and they basically urinate in it. So it's very important for the patient to not contaminate the sample. So it's important for them to not touch it. And, as you can see, as you can imagine, it would be possible, as the urine is coming out, it could basically pick up bacteria from the skin. So it's possible that it could be contaminated, but this is easy and most commonly used. Another method is midstream clean catch urine, so most commonly referred to as clean catch. The reason this is preferred but it's not as easy is because this is less likely to be contaminated. So basically the patients are actually required to cleanse the area first, and then they're going to void the first portion of the urine into the toilet, and then the remaining urine into the cup. That way, hopefully, the urine is less likely to pick up bacteria from the skin as the urine comes out. The next method is catheterized urine. So this is basically done in patients who have a Foley catheter in place. So this is common in the hospital, especially a lot of the patients in the hospital already have a Foley catheter in place for various reasons. So if so, you can easily collect the urine and avoid any contamination. And there's also suprapubic aspirate. This is basically a needle is used to go directly into the bladder and pull urine out. So it's not as commonly used, but occasionally if there's obstruction and the patient is unable to actually urinate, and there's but the kidneys work and the urine is being produced, we can actually go directly into the bladder and draw the urine out. I know sometimes this is done just to get rid of the urine. And sometimes it's also done to get the sample to send to the microbiology lab. So here's what happens in the micro lab. So urinalysis is the easiest thing you can do, is the cheapest thing we can do, and it's the most commonly done thing in the hospital. So once you get your urine sample, and it comes to the micro lab, the first thing they do, they have these strips for urinalysis. So they have these strips are they have different sections on it, and what they do is that it's basically a dipstick. So they just dip it into the urine, and as the color of different sections change, they basically interpret it based on the color. So this is immediate. So as they dip it into the urine, the colors change and they can see it. So you get the results the same day that the urine sample is sent to the micro lab. And you don't need to memorize this or anything. It's just for your information. But basically, there are, based on the color, they will tell you, the results of the UA or urinalysis. So I'll give you one example. So for example, one thing that they look for is the presence of nitrite. So there's a section on this on the strip for nitrite. So basically they just see how the color changed, and they will tell you if it's negative or kind of positive, and then definitely positive. And you can do this for other things. For example, if they wanted to see if there's glucose present, if it's yellow for this particular test, they would say it's normal, and so on. So here's what you really need to know. So once the results of the urinalysis is reported, you need to be able to interpret it. So a normal urine, it's supposed to be clear and yellow. So if you find it to be cloudy, it can be due to different reasons. Either there's an infection, or especially in patients who have kidney disease, because there's damage to the kidney and things that are not supposed to be there find their ways into the urine, such as protein or any other chemical from the body, it will make it look cloudy. So cloudy doesn't necessarily mean infection, but it could. Another thing that's important to look at is the presence of nitrite and leukocyte esterase. So if nitrite is not supposed to be there in the urine, so if you do find nitrite in the urine, it could suggest the presence of bacteria. Now, if the nitrite is not there, doesn't necessarily mean that there is no infection, and I'll explain that more on the next slide. If you find leukocyte esterase, that means there white blood cells are present, because these esterases are released from the actual white blood cell from the body. So if you do find the leukocyte esterase, that just means that there are white blood cells present, and we call this pyuria. So pyuria means the presence of pus in the urine, or more specifically, the presence of white blood cells or leukocytes in the urine. And you can actually measure how much white blood cell is in the urine. So the exact definition of pyuria would be if you have white blood cell of more than 10, then we call this pyuria. Of course, you can also see if there are bacteria in the urine. So the presence of bacteria, we call this bacteriuria. However, note that in a urinalysis, if you do find bacteria, this could be due to contamination. So this is, this may not necessarily be bacteriuria, it could be just contamination. And the way that we check for contamination is that we look at epithelial cells. So epithelial cells are from the skin, so you shouldn't have it in the urine. So if you do find significant amount of epithelial cells in the urine, that means they're coming from the skin, which means that your sample is contaminated. So if you do find bacteria and epithelial cells significantly, you have two options. Either you really have bacteriuria in the patient and also it got contaminated, or the patient doesn't really have bacteriuria but it got contaminated. And the only way to distinguish that is by actually doing a urine culture and see if we can grow actual bacteria. But epithelial cell is what you look for to see if the sample is contaminated. And then if you have casts, there are different types of casts that are used to assess kidney function. If the patient has pyelonephritis can also cause some damage to the kidney, which kind of explains why you will see casts. So if you do find casts in the UA, doesn't necessarily mean pyelonephritis. It could mean either the patient has AKI or CKD, or it could be pyelonephritis. So these are things that are used in combination when you do patient assessment. So for example, if the patient normally has if the patient doesn't have a history of kidney disease but suddenly comes to the hospital with fever and flank pain, and you see casts on the UA, that could suggest that the patient could possibly have pyelonephritis, and the physician will do further imaging to confirm the diagnosis. Let's see what else I didn't talk about. Oh, the pH. Some organisms such as Proteus mirabilis are capable of splitting urea, which will increase pH. So occasionally you will see that the pH will be higher than the normal range, and that kind of helps you suspect Proteus mirabilis. So when you choose antimicrobial agents. Okay, so bacteriuria I talked about, sterile pyuria. Sometimes you will not have bacteria in the urine, but you will see white blood cell increase. That's what they refer to as sterile pyuria. So pyuria, that means pus is present, white blood cell. So there's some sort of infection going on, but it's sterile because you didn't see any bacteria. So this can be due to different reasons, but one would be, for example, if a patient has a viral infection, you will still get the white blood cell response, but there will be no bacteria. So that's just important to know, because if you get sterile pyuria, sure, the patient has some sort of infection, but you don't need antibiotics to treat it because you didn't see bacteria. And of course, you would like the urine to be, you would like to see sterile urine in most patients, and it's important to rule out contamination. So here's the nitrate cycle. So basically, nitrates are important. So as you eat food, nitrate will be part of the food that comes into the body, and of course the bacteria that are part of the flora will use nitrate as food, and this cycle continues. However, by the time it makes it back to the urine, you will still have nitrate. So nitrate goes back and forth by bacteria. Bacteria will convert nitrate to nitrite, but the end product that goes actually to the kidneys is nitrate itself. So nitrate comes from the food and also is excreted to the urine. So by the time it goes to the urine, you should only see nitrate. And what we check on urinalysis is nitrite. So because you are only supposed to have nitrate in the urine and not nitrite, and you're not really supposed to have bacteria in the urine, if you do find nitrite in the urine, that could suggest that there are nitrate reducing bacteria in the urine that are converting the nitrate, which is supposed to be there, into nitrite. So that's why we check for nitrite. If we detect it, you suspect that there are bacteria converting the nitrate in the urine to nitrite. And there are nitrate reducing bacteria such as Enterobacteriaceae. So most common member of Enterobacteriaceae family is E. coli, and also Pseudomonas. So that's what we suspect. Now the reason I mentioned earlier that if you do not find nitrite in the urine doesn't necessarily mean that there are no bacteria is because if you have too much of these bacteria, once they run out of nitrate, then they start to use nitrite as food and convert it to ammonia. So if you have too much bacteria, then nitrite, they will use all of the nitrite. So when you do your test, then nitrite shows up negative. So that's why, if it's positive, it suggests there are bacteria. But if it's negative, doesn't necessarily mean that there are no bacteria. Of course, if you don't have bacteria, nitrite would be negative. But if you have too much of nitrate-reducing bacteria, you will also not see nitrite. To make it more complicated, there are also non-nitrate-reducing bacteria. So if you have any of these in the urine, they're not gonna touch the nitrate. So your nitrite will be negative again. So it's not a perfect test. If nitrite is positive, it suggests that there are bacteria, but if it's negative, you need to keep looking.